Medurstand. Understanding medicine.
Professor Aziz Rehman from Medurstand, and today we are going to demonstrate the clinical methods in GIT, how to examine gastrointestinal system. And we specifically palpate the spleen. The spleen, you know, is situated here, well behind the lower costal margin, somewhere here, and you can't feel normal spleen. It is not palpable. So when we palpate it, we typically start from here, because when spleen enlarges, it enlarges in this direction. It comes down here, becomes palpable in the left subcostal margin here area, and then it moves this way. And occasionally there may be massive splenomegaly, and the lower border could be actually felt here. Sometimes it can be mistaken with guarding. It could be so big. So I think traditional teaching is that you start from here. So I will again do the same method, same technique, press it gently, and then with the medial end of this index finger, I'll try to feel it. I'll make this scooping movement like this, and when I approach the spleen area, we will ask him to take a deep breath. सांस लंबा ले जरा, like this. Okay, छोड़ दीजिए, फिर लंबा सांस, फिर छोड़ दें, फिर लंबा सांस. I don't see. Even during inspiration, I don't feel spleen because it is not enlarged. But I think to make sure that it is not enlarged at all, because you know spleen has to enlarge by 2 to 3 times before it becomes palpable. So to make sure that if it is enlarged but not to that extent, we'll ask the patient to turn rightward, right, like this one, and I will press this part forward and do the same method again. Lamba saans, lamba saans, lamba saans, lamba saans. Again it is not palpable. So spleen is not enlarged at all. Listen. But just to make further sure, I think there is another technique that once spleen enlarges, it comes forward, and there may be a situation when it is enlarged but it is not palpable below the costal margin. So what we do is that we try to percuss this area. This triangle is called Traub's area. Normally it should be resonant. Why it should be resonant? Because this part consists of stomach and intestine, which contains gas, and gas produces a tympanic or resonant tone. But if this area becomes dull, it would imply that there is some solid structure under this area, and it could be spleen. So this is how we do it. I am getting the typical resonant tone because of the stomach underneath. So there is no splenomegaly. Once there is splenomegaly, again you would be asked about the differential diagnosis of splenomegaly. There could be minimal splenomegaly, there could be moderate, there could be massive, and differential diagnosis is accordingly different. In massive splenomegaly, typically we suspect malaria used to be a cause, but perhaps it is not a very common cause these days because there is effective treatment. I think in my experience, the causes of massive splenomegaly would include a myeloproliferative disorder like chronic myeloid leukemia or some lymphoma, or maybe myelofibrosis, something like that, or maybe some other infection. It could be enlarged in endocarditis, it could be enlarged in tuberculosis, it could be enlarged in many other conditions like dengue also, and also cirrhosis. I think you have to go through the list of causes. But remember, you have to differentiate between minimal splenomegaly, moderate splenomegaly, and massive splenomegaly. How you know that what you are feeling here is spleen? Because it's because of its characteristic notch. The lower edge of spleen has a very typical notch, and even when there is splenomegaly, that notch is maintained. So to differentiate splenic mass from another mass in this area, you would appreciate that notch. If you cannot feel the notch, then you may not be feeling spleen, it may be something else. So I think that is how to differentiate between the two.